All right, good morning, everybody. I'm Aaron Fichtner. I'm president of the New Jersey Council of County Colleges, and it's my honor and pleasure to welcome you all to what we hope will be a long series of productive discussions as we launch the Health Services Collaborative. As many of you know, we have partnered in the community colleges with NJBIA, New Jersey Business and Industry Association, to launch the Pathways to Career Opportunities initiative to make sure that we are aligning education with the needs of the changing economy and building an ecosystem that allows all of us to collaborate. And it's with great pleasure that I want to introduce for some opening remarks, Chrissy Butius from NJBIA. Good morning, Chrissy.
Good morning, Aaron, and thank you everyone for joining us. It's so great to see everyone here today. I know that we're joined by not only the business community, but our academic partners and those in the legislature, as where I see Assemblyman John Catalano, who's joined us as well. So this is a really exciting time for us, and I know many of you have heard me probably say this already, but we are at a crux right now where developing our future generation of workforce is really critical to the business community, and to have a partnership with our community colleges as well as our academic partners, both private, 4-year, you name it, as well as our government and policymaker partners is really critical to ensuring that New Jersey is best positioned to have the workforce of the future. You know, we at BIA always say that we want to reclaim our state as the innovation state and to ensure that we always have the #1 workforce in the country. And I know that through this initiative, with the support of the administration and the legislature and our partners in various government departments and with the business community at the table, we're able to achieve that as well. When I came to BIA, one of the first things I heard from our employer community was, we want to make sure that we are able to attract and retain a workforce that meets the need of an ever-changing and dynamic workforce. And that has been a constant challenge. And I'm sure many of you either live it or have experienced it and may have received that feedback as well. Why we're very excited about this opportunity is because the business community is at the table with everyone, trying best to inform on labor market trends and where the trajectory of the economy is going to the best that anybody can predict. And I think we're suffice to say that no one can predict the future right now, but if we can all work together and make sure that we're able to change as quickly as possible and to adapt, I think that's really critical for all of us collectively moving forward. And so Aaron, Catherine, team at New Jersey's community colleges, thank you for this continued partnership. Looking forward to a very robust conversation today. Healthcare is key. It's a huge economic driver in the state. We have a healthcare workforce crisis, and this is a critical conversation. So thank you.
Chrissy, thank you so much, and thank you for your vision and leadership in being a tremendous partner with community colleges and all the other entities in the Pathways to Career Opportunities initiative. As Chrissy said, we agree in the community colleges that we are in this unique moment in New Jersey's history as we emerge from this pandemic and reclaim our role, as Chrissy said, as having the most innovative and productive and entrepreneurial workforce in the country. We have long been a state that is highly educated, highly skilled, and that is our future. And we are committed to working together to achieve everything that Chrissy said, while we're creating a more equitable future for our state, opening up more opportunities for all of our citizens and residents. To do all of that, we believe we need to do 3 things. 1, we need to better understand the changing needs of the economy and employers. 2, we need to build a strong ecosystem of education and training providers to encourage collaboration and partnership. And 3, we need to develop new curriculum and new partnerships to help invigorate the already excellent educational system that we have in New Jersey. We are here to embark on 2 of those 3 important steps. So the purpose of the collaboratives, and we're so happy to have people from all over New Jersey, from all perspectives, at the table in this discussion. Purpose of the collaboratives is to do 2 things. 1, better understand the changing landscape of employers. We will be convening an industry leadership team to guide this work. We are partnering with the State Department of Labor and Workforce Development to bring better labor market information to the table. And today we are starting a discussion about the changing labor market landscape with presentations that you will hear in a minute from Focus New Jersey and from the New Jersey Department of Labor and Workforce Development. Number two, we are here today to start building this ecosystem. We have to find new ways to work together between high schools and community colleges and four-year partners, community-based organizations, the workforce development system, proprietary institutions, all aligned with the needs of employers and informed by the perspective of labor unions. So this collaborative is the space where we will all come together to build those partnerships, to create common understanding of the changing needs of the economy. And we are hopeful that at some time soon, we will be able to have at least some of these meetings in person to encourage the level of networking and collaboration that we know happens in person. A corollary to this entire collaborative effort is our establishment of centers of workforce innovation across the economy. We are establishing 10 of these centers, 2 of which are in healthcare, 1 in patient care, the other in healthcare administration and technology. Our community colleges or selected community colleges are leading each of those centers and will be partnering with high schools, four-year colleges and universities, workforce development partners, community-based organizations, and proprietary schools to develop new curriculum models that can be shared across the state. So we are so excited to be with all of you today to launch our collaborative effort to build that ecosystem driven by the needs of employers. So again, today's goal is to really start this conversation. So I encourage all of you to be active in the chat. As you hear points and presentations and ideas, please offer your suggestions and perspective. We need all of you to be active participants in this important work. So today we will hear about the labor market landscape, and we'll begin to talk about promising strategies for building the pathways that we know will ensure that we have the most competitive, productive workforce for the health services industry that we possibly can have. So thank you all again for being with us today, for joining us in this important journey. We thank the governor, the administration, and the legislature for their support and partnership of this work, and we look forward to achieving incredible things through these collaboratives. So with that, I'd like to introduce Catherine Stargell, who is our Senior Director at the Council leading this important initiative. Good morning, Catherine.
Good morning, Aaron. Good morning, everyone. I just want to echo Aaron and Chrissy's welcome. We're so pleased to have a great response to this initiative, and your participation and engagement is key. So thank you for being here today. The theme of today's collaborative meeting is the labor market landscape and pathways. And to start us all out, we're going to have a presentation on the labor market information current surrounding this industry, health services. And we are honored and pleased to have 2 of our very important partners join us for this presentation. First, we have Kyle Southerden, who is the Executive Director of Focus NJ. As many of you all might know, Focus NJ is the research organization created under the New Jersey Business and Industry Association. Thank you, Kyle, for joining us. Supporting Kyle's presentation is Jason Timian. Jason is a chief, I believe, at the New Jersey Department of Labor and Workforce Development. Do I have that right, Jason? Yes, okay. He's a chief in the Office of Research and Information. And he probably knows every single word and punctuation on the in this presentation, because it is his staff at the Department of Labor that creates and updates labor market information for the entire state. And we're happy to be partnered with Department of Labor and have at our fingertips those resources. So I will turn over this segment to Kyle and Jason. If you have questions throughout this presentation, please include them in the chat box, and our staff will collect them and present as many as we are able to Jason and Kyle to respond to after their presentation. Thank you.
Great. Thank you so much, Catherine. Good morning to everybody, and thank you for the opportunity to speak with you this morning. My name is Kyle Sullender. I'm the Executive Director of Focus New Jersey. We are an independent research nonprofit conducting nonpartisan economic and workforce research to support sound public policy in the state of New Jersey. I'm extremely excited to be working with NJCCC to support the Pathways program. And I'd also like to thank our colleagues at the New Jersey Department of Labor and Workforce Development before we get started today for their work compiling the following presentation and also for working with us so collaboratively to bring it to you this morning. For the next 20 to 25 minutes or so, I'll be providing an overview of the health services sector in New Jersey, hopefully providing a level set of where the labor market stands currently in 2020, with a little bit of additional information on where it is expected to be moving forward. This is going to include an examination of the size of the sector and a breakdown of its various components, the demographic composition of the workforce, the jobs and occupations currently in demand, as well as some other top-level insights. As I've noted, the goal of this discussion is really to provide a broad overview of where the labor market stands today. In the interest of that end of time, the presentation that we'll be sharing with you this morning has been created to work with multiple audiences in multiple formats. So given our time structure and the information I think is important for us to cover today, you may notice that I'm skipping a few extra slides here or there, not in any way indicating that that information is not important, but to try to hit the areas that we want to hit in the time allotted. With that in mind, I'll note that if the slides have not already been shared with the individuals on this call, they certainly can be at the conclusion. They're also available publicly at the Department of Labor and Workforce Development's website. So with that said, let me make sure that I know how to share my screen with you all, and we can jump into this presentation. So throughout the presentation, we'll be seeing this word cluster. We're going to get into how that cluster is defined and what makes up its various components in just a moment. But we're going to start with a couple of high-level insights. Together, the healthcare cluster in New Jersey contributed just over $44 billion to New Jersey's gross domestic product in the year 2020. That equates to roughly 8.2% of all output in the state. From 1990 to 2019, the healthcare industry was actually the only industry in New Jersey to add jobs every year. And that trend was really only interrupted in 2020 because of the pandemic and the related shutdowns. Now, by the year 2028, and we'll talk more about this really towards the end of the presentation, the industry is expected to add an additional 64,860 jobs to the more than 460,000 that already exist. Now, as I noted a moment ago, it's important that we address where these jobs are and what they look like. So as we talk about the healthcare cluster or the healthcare sector, what we're really referring to are these three major components: ambulatory healthcare services, hospitals, and nursing and residential care services. Perhaps more than any industry in New Jersey, the healthcare industry is extremely diverse, both in terms of the educational requirements of various occupations, as well as the workplaces that individuals actually conduct this work in. And so as you look through the various settings that are just examples, certainly not comprehensive on the slide in front of you, you'll see a range of workplaces from the office of your local physician to blood and organ banks to medical laboratories and nursing homes. Now, over the past 30 years, the distribution of jobs in these various components has actually shifted pretty dramatically. As you can see on the left-hand side here, in the year 1990, roughly half of all healthcare jobs were in hospitals. Only about a third were in those ambulatory healthcare service centers, and 18% in our nursing and residential care facilities. By the year 2020, that pattern had almost completely flipped between hospitals and ambulatory healthcare services, with the latter group coming on to take more than half of, or roughly half of all employment in the sector, and hospitals coming down to that 1/3 mark. We'll talk a little bit more about the growth in residential and nursing care facilities later, but you'll notice that the overall distribution of jobs in that sector as relative to the whole hasn't changed much. Now, you can see on the bar graph on the right side of your screen as we move to the next slide that over the past 30 years, the distribution has continued to increase. So the growth of the industry has increased by an annual rate of approximately 2.9%. But there are some additional interesting insights contained within this information. For instance, if you're able to pinpoint it on your screen, and I'm not sure how easy it is to see via this format, the year 2003 is the year when that ambulatory healthcare services component actually overtook hospitals to become the largest employer component of the sector. Meanwhile, if we look at those purple segments on the top of each bar, those are denoting the number of nursing and residential care facilities employees. What you'll note is that although on each year they tend to be the smallest segment of the bar, they have actually experienced the fastest growth over this 30-year period, from 48,000 jobs in 1990 to roughly 95,000 in 2019, prior to that slowdown again in 2020, which you'll note is the first year that that total bar actually drops. Now, we've talked a couple times already in just a few minutes about 2020's impact on the industry. And so I think it's natural coming out of the pandemic to be curious about the resiliency of many of our industries in New Jersey. And although there are significant differences between the very short COVID recession we experienced in 2020 and the Great Recession of the late 2000s, I think it's useful to compare how the industry performed then as a way of looking through to the potential stability of any future interventions in the industry's growth. During the Great Recession, the healthcare sector actually still added nearly 10,000 jobs, while the remainder of the state's private sector lost 175,000. And so, although we experienced that dip in 2020, there's reason to believe that the healthcare sector experiences greater stability, perhaps, than the economy writ large in New Jersey. Now, I warn you as I move forward, this is going to be our largest slide skip of the presentation as we move forward to begin considering the geographic distribution of these jobs and the various components of the healthcare sector throughout the state of New Jersey. And noting at the top that on average, New Jersey employs approximately one healthcare worker for every 20 of its residents, but that distribution is not even across the state. You can see on the map on the right side of your screen the distribution of those workers at the county level. And what you'll find upon this examination is that although employment tends to mirror the state's population, there are outliers on a county basis. Bergen, Monmouth, and Camden counties actually employ a disproportionately high number of workers relative to the size of their respective populations. We're going to talk about the reasons why as we move forward with the distribution of some of the sector's various components. But I'll note at the top that what we're looking at here is really the distribution of the major urban centers that we share cross state boundaries with, as well as the population distribution along the shore and coast. That'll affect some of the specific components moving forward. We can see that this is relatively consistent as we switch slides here to look at the outsized proportion of county employment in the healthcare sector. And so once again, you'll note that Ocean and Camden counties have the largest proportion. Roughly 1 in every 5 of their total employment figure is in some form of healthcare. I'll note the difference between the two slides because they look very similar and they're measuring similar things. On the previous slide, as I flip back here, looking at the healthcare to population ratio, and this tells us that certain communities may actually be service exporters. This is the ratio of healthcare employees to the population. Here, we're looking at healthcare employment as a share of total employment in the county. And so when we look at Ocean, Camden, and to a degree, Monmouth County, who's very close, we see that roughly 1 in every 5 people employed in that county are employed in some form of healthcare. On the flip side, Hudson, Somerset, and Cape May have different compositions and tend to engage less of their workforce in healthcare, just around 12% of their total employment. Some of the reasons why, we can start to look at the distribution of the various components of the sector. So here we see the distribution of hospitals. There are 75 hospitals throughout the state of New Jersey. serving the state's population of roughly 9 million residents. These numbers range from 9 in Essex County down to 1 in Somerset. And again, you'll find that they tend to be clustered around the state's 2 primary highways, the New Jersey Turnpike and the Garden State Parkway, as well as those cross-state bordering major urban centers, our New York City for Bergen County and Philadelphia in the Camden County area. Now, you'll notice that the shading on the map to the right side of the screen continues on each of these slides to be a little darker on the right side, whether we're talking about healthcare employees or the population. And I think that's explained pretty succinctly by this following graph here. This is the percentage of county population aged 65 and over. And we can see the aging populations tend to be clustered together predominantly around that shore coastal region, or again, outside of those major urban centers where the population is higher. Cape May has the largest proportion of individuals aged 65 and over. On the map to the right side of your screen, in addition to that density color coding, you'll also see a series of red dots denoting the location, the physical location of nursing and residential care facilities. And so you'll note how they tend to be clustered around those populations, which gives us a fair bit of insight into where they will likely continue to grow in the years to come, as well as that employment demand will continue to be. This is a logical connection, but also good news for the residents who need care, that these services tend to be responsive to the populations that need them. Now, there is a lot of additional information in this document regarding geographic distribution of various components of this sector. And as I've mentioned, we don't have time today to go through it all. But for those who are interested, again, the slides are available. And there is information contained here with regards to the distribution of pharmacies, urgent care facilities, and trauma centers. But right now, I'd like to shift focus and really begin to talk about what the specific jobs and occupations are that make up this sector and make up that distribution that we've looked at. So in 2020, roughly 2/3 of workers engaged in healthcare were engaged in patient care. And so on the pie chart in front of you, you'll note those 2 large categories are our healthcare practitioners and our healthcare support staff. Outside of those categories, we'll begin to see our office and administrative workers making up 17% of the sector, social services and management making up a combined 7%, and then that other category at around 11%. I found this slide to be extremely interesting when I started diving into this data and this information. And for me, the reason was because when I think about the healthcare industry, just the first couple things that come to mind, it's certainly those first 2 tranches of workers that pop into mind first. Our healthcare practitioners and our healthcare support staff, the individuals who are patient facing. And then as I think a little more, I think of our administrative and office support members and the social services and the management staff. But to see that 11% is still engaged in that other category was very interesting. And as we talk about what that other category is, and we'll see a few of the specific occupations which are contained within it in a moment, we're talking about people like food preparation workers or food workers actually serving meals to individuals inside of a hospital, or maids and house cleaners inside of a physician's office. And so the healthcare sector, although it contains those jobs and occupations that might be traditionally thought of, does contain a large portion of individuals who may not be the first that come to mind. Now, in terms of specific occupations, we'll see a list here of the top 20. And again, a lot of information here. I promise I won't just read this chart to you. But together, these 20 occupations make up roughly 2/3 of all occupations in the healthcare sector. You'll note that at the top of the list, the most common is our registered nurses, with just over 68,600 registered nurses employed in the state, accounting for roughly 14.7% of the entire industry. What's interesting is, although registered nurses require a bachelor's degree, the next 4 of the top 5 most common occupations in the healthcare sector require no more than a post-secondary non-degree award, and collectively make up more than 20% of the entire healthcare sector. These are our nursing assistants, home health aides, receptionists and clerks, and medical assistants. There's a number of interesting things to take away from this graph, and some of which we will continue to discuss over the next several minutes as we work through the presentation. But if you just scan this list very briefly, you'll note the incredible diversity within the healthcare sector with regards to average salary expectations, as well as educational requirements. This sector contains some of the highest educational requirements in order to obtain an occupation, as well as plenty of jobs that require very little, maybe no formal education credential, or some of those moderate requirements. And we're going to talk in a moment about what those look like. A few final top level notes as we walk away from this slide. The average salary across the entire healthcare sector is roughly $63,000. And we do see that mapped onto these top 20 occupations as well. Now, I just referenced the diversity among educational requirements. And so here we have an actual breakdown of what those look like mapped onto the occupations of the healthcare sector. You'll see them broken down into three tranches. Our low requirements, these are high school degree or equivalent or no formal educational training. Our moderate requirements, associate's degree, post-secondary non-degree awards, or some college with no degree makes up less than 1%. And then our high requirements, these are our bachelor's degrees, master's degrees, and doctoral degrees. Roughly 38% of jobs in the industry fall into that low requirement area, which I found interesting. 27% fall into the moderate range. And even within that 27%, it's really 21 to 22% are in that post-secondary non-degree award area. Only 5% are in the associate's degree range. In the high requirement area, we start to see more bachelor degree requirements and relatively few doctoral or professional degree requirements. There, we're really being limited to those physicians and specialists, and we'll talk more about those in a second as well. What I also find interesting here is the graphs to the right side of your screen, which actually show the distribution of these educational requirements mapped onto those various components. So just briefly, you'll note that in hospitals, we tend to have the largest share of occupations that require those higher educational achievements, our doctorals and our master's and our bachelor's degrees. But ambulatory healthcare services, which is our largest segment, as we noted earlier, has a pretty even split between all three. And the largest segment of those occupations require our low requirement area. The same is true for nursing and residential care facilities, although they tend to have the largest share of those moderate requirement jobs. Now, looking at the salary expectations, which we noted a moment ago on that top 20 expectation page, or I'm sorry, occupation page, we can start to see again this really large diversity with regards to the earning potential of individuals engaged in the healthcare sector. And I don't think that this is really surprising as we start to look at the list of occupations that are on that higher end. Here we're seeing our anesthesiologists, our surgeons, our gynecologists, psychiatrists, other general and specialized medical practitioners. And then on the lower end, we start to see again more of those occupations which would likely have that no educational or formal training requirement attached to them. So here we're talking about our home health aides or food workers, orderlies and maids. But we do see an extremely broad range in terms of salary expectations within the healthcare sector, from nearly $300,000 all the way down into that $28,000, $29,000 range. Now, I want to make sure we leave a few minutes for questions. So we have two components left to discuss with regards to the labor market landscape in healthcare. We have our demographic profile, which I'll move through relatively briefly, and then a few final concluding notes on the expectations for the industry moving forward as we look at the jobs outlook up into the next 5 or 6 years. So one major takeaway with regards to the demographic makeup of this labor market is that it is aging. The data currently shows a steady and gradual change toward an older workforce in nearly every age cohort. The number of healthcare workers aged 65 and older has tripled in the past 20 years, and we see growth in the 55 to 64 range as well. The only age cohort that is actually has significantly fewer workers in 2020 than it did in the year 2000 is that 35 to 44 range. I suspect that in some ways this mirrors the aging of our population, but it is something to keep in mind. Some additional brief notes on the demographic composition of the workforce. The healthcare workforce is overwhelmingly female, which is certainly an outlier when compared to the New Jersey economy writ large. Roughly 75% of the healthcare workforce is female, outnumbering men 3-to-1, whereas the general industry mix in New Jersey tends to be split 50-50. The healthcare workforce is actually more diverse than the rest of New Jersey's workforce, particularly among Black and Asian populations. If you look at the pie charts to the right side of the screen, it's the second one down, you'll notice African American or Black individuals making up 22% of the healthcare sector versus just 13% of New Jersey's writ large workforce. Unfortunately, what we don't have today, which would be extremely interesting and helpful probably to view, is how these demographics map on to specific occupations. Perhaps there's room for additional research there in the future. And finally, a note that the workforce is not particularly more or less Hispanic with regards to ethnic makeup than the economy writ large, slightly smaller, but not significantly so. Here we have a further breakdown of the educational achievement of healthcare workers versus the personal earnings achievement. So while we've looked at the past at the breakdown of occupational requirements, this actually tells us the educational achievement level of the workforce as it stands today, as well as the earnings breakdown as it stands today. And while we talked about the upper end of that salary expectation being in the $300,000 range, I think this puts it in perspective a little bit more, as we see only about 7% of the industry is making above $150,000 per year, whereas half is making in that $50,000 to $75,000 range, and another half is in that $25,000 to $50,000 range. Educationally, we see numbers that pretty much match what we saw a few slides ago. I believe the figure of occupations requiring a bachelor's degree was around 22%. We see here that 27% of the sector has actually achieved one, and the other numbers roughly map on as well. So with that, I want to switch to outlook. I want to conclude by looking at where this industry is heading, which I think may be perhaps the most important part of all of this information for a number of the folks on the call as you begin to prepare career maps and pathways for individuals moving forward so that they can have successful and sustainable careers moving into the years ahead. The aging population of the baby boom generation will continue to increase demand for the healthcare industry. The percentage of New Jersey residents aged 65 or over is projected to reach around 20% by the year 2034. And this will result in large increases in employment for areas such as physical therapy, residential services, nursing home care facilities. And we're going to continue to see the demand increase as this population ages. And you'll remember we addressed at the beginning of the presentation some areas in the state where we may see that demand increase more than others due to the higher proportion of older residents. And I have carefully avoided the word elderly when referring to these residents, knowing that some folks on the call may be close to that 65 range and take issue with it. So I don't want to stir up any controversy with our definitions of that term, certainly. The healthcare industry has steadily gained employment for the last 30 years, and that trend is expected to continue through the year 2028. That said, we've referenced the sector's strong employment growth several times already, and though employment is still growing, again, eliminating that 2020 very unique gap that interrupted that trend. It should be noted that the pace of growth is different as we look across the decades that we're considering. So during the 1990s, that annual growth rate was around 3%. It dropped to around 2 during the 2000s, and it's expected to be in the 1.2 range from 2018 to the period ending in 2028. Still, there will be ample opportunities for employment in the industry as it struggles to increase its workforce for growing demand. We have that aging population of individuals currently engaged in the workforce who will be reaching retirement age. And so although the opportunities will be there, there may be a disconnect between the industry's ability to find that workforce and meet the demand that is growing with the aging population. One final note on the projections for the industry moving forward as I conclude is we can look at the expectations for employment growth at the sector or component level. Here you'll see ambulatory healthcare services, which we noted became the largest component of the healthcare sector in the year 2003, will continue to grow at a robust rate of roughly 2%. On the flip side, hospitals will have are expected to have the slowest growth rate, but are still expected to add around 11,390 jobs by that period. Hospitals will also continue to grow, but at a rate slower than our ambulatory healthcare services. At this point, that is the final slide in the presentation. I want to thank everybody for your attention and for your time. I know this was a lot of information. Hopefully, if there are any questions, we're able to answer them now with Jason's help or follow up after today's meeting. I want to thank you one more time. And at this point, I will turn it over to Catherine if we have any questions.
Sure. Thank you so much, Kyle. We really appreciate your presentation. If you can unshare, that would be awesome. I know Kyle is used to not Teams. What is it that NJBI?
No, it's Teams. Yes.
Teams. Okay.
We're all in our factions now.
That's right. So, but you worked Zoom very well. Thank you so much for your informative presentation. I want to now introduce Sandra Bleckman, who is the Director of Strategy and Workforce Partnerships for the health services industry sector. She and our program manager, Stephanie Samuel, will present the questions to Kyle and Jason from the chat. Thank you all for putting those questions in the chat box, and please continue to do so. Sandra?
Good morning. Thank you, Catherine. And thank you, Kyle. This was terrific. And as we can see, the chat is buzzing. So that means that it was a great and stimulating conversation and presentation. So I'm just going to go through and just ask a few questions as time allows, if that's okay with you. But someone made a comment that I thought was really interesting, Francisco, that it would be interesting to see how those demographics fall into the various education levels as well. So maybe as a thought for a future presentation, if we could include something like that, I think that would be very helpful for the work that we're doing. And so let's see my chat function. I'm moving it as, okay, let's see. We had another question here. Okay, is there market research data on foreign healthcare nationals that earn degrees outside of the US that can be upskilled to address the skills gaps?
So we probably can get access to numbers of H1B Visa people coming in, but I don't know that we would have information on what type of education they're obtaining overseas.
Jason, am I correct in assuming that we likely wouldn't know that information until they were engaged in our workforce, at which point we might be able to collect some of that?
After the fact, yes, but it's not something we would be able to predict a pipeline coming in now.
Okay, thank you. Also, can you share what is a percentage of full and part-time work in the sector? As we know, a lot of the home health aides and other positions are only hired for part-time hours.
Sure. So that type of information would come from our American Community Survey, which is a subgroup of the U.S. Census Bureau. I would think that would be a bit misleading looking at the industry as a whole, because home health aides are quite different than many other different types of occupations found in the healthcare sector. If you wanted a number of home health aides, that would be a specific run that I could do and could get back to this group. Sure. But I just think having all the different types of occupations in the sector all pushed together, that number wouldn't have much meaning.
Okay, thank you for that. Stephanie added a question for us as well. Is New Jersey ready for the increase in healthcare needs from the aging baby boomer population? If not, what will ensure readiness?
Jason, I know we touched on it at the end. I don't know if you have a little more color to add, but certainly I think the aging of the current healthcare workforce nearing retirement age is a concern as that demand increases. It seems like the two don't quite line up the way you'd want the younger folks to be coming in as that demand ramps up, but we might actually be seeing the opposite, that there will be a tightening of the workforce at a time when we need more folks.
Right. I mean, you have two forces hitting at the same time with the aging current workforce and the future demand for new people to fill those jobs. I think there's going to be tremendous demands, and the community college system and all educators in the state are going to play a big role in filling that pipeline. I apologize. I have a building being torn down like right behind me, and it's a bit distracting, so I lost my train of thought there. Would you just please repeat that? I had another point, Sandy.
The question?
Yes, please.
Is New Jersey ready for the increase in healthcare needs from the aging baby boomer population? If not, what will ensure readiness?
Oh, right. So yeah, like Kyle said, oh, I remember my other point. I'm sorry. The tremendous drop that we had as a result of the pandemic, I have no reason to believe that the healthcare industry is not going to get right back on that growth track that they were on prior to all that. Adding jobs every single year over 30-year span is the only industry that has done that. I look at that very deep spike downward as just a blip on that trend line.
Okay, thank you. I have a question also about the slides that you presented. They indicate that the employment sector is still growing. I know, Kyle, you were saying it's slowing down, but do you think that this projection would be inaccurate now since it was predicted pre-pandemic? Because I think there's been a major change within the sector since the pandemic.
Right. These projections were developed 3 years ago now. So yes, certainly they could be questioned without a doubt. We're actually set to release a new set of projections this June that'll cover the years 2020 through 2030. Now, what effect the pandemic has on the modeling behind those remains to be seen, but they will be released this summer. We do have two actual data sets that that aren't included in the presentation that you all saw today that I think could shed some light on the employment trends. One is a data set that we started paying particular attention as a result of the pandemic, and that is uninsured claimants, either initial claimants or continued claimants. That is, initial claimants are an indicator of someone who may have been displaced from their job, and continued claimants we're able to track over time to see how long those people are having trouble getting back to the workforce. So we've actually been producing and publishing files weekly. So I recognize some of you on this call may be receiving those files, but that really gives us a good real-time indicator of what types of jobs, what types of industries, and then some demographic information on the people who are currently displaced from the workforce. The second data set that we have access to is using our proprietary software that allows us to extract information from online job advertisements. This data is updated daily, so it really gives us a true picture of current employment demand. So marrying those two data sets together can really give us the best real-time picture of what's going on in an industry, right now. That's neither of them are included in the report that you saw today because they change so frequently. By the time we publish, the data would be old.
Great. Thank you, Jason. And I think we'll be asking you to report once the new data set is out, right? In one of our next collaborative meetings, since we'll be hosting these monthly. So yeah, both of you have job security coming soon in the summer. Catherine's got her thumbs up. There's a very interesting comment. Long-term care industry lost the most jobs over the start of the pandemic, over 410,000 nationally. And the question is, are there initiatives such as tuition assistance to attract new healthcare workforce from CNAs to nurses? And this is really an opportunity that I want to just mention, the Community College Opportunity Grant Program that was signed into law. So we have been working, actually, our WJ Barnabas is a great example. We have John and Lourdes on the call of the program that we've run, and we have, I think, close to 400 students now enrolled that are current employees of RWJ Barnabas. So we are expanding the Community College Opportunity Grant Program, but it is a great opportunity for current employees to upskill and reskill, as well as those that are out of work. So we can post something in the chat also with some of information about CCOG. But we, in this Pathways program, we are looking to include also how do we fund those college programs as well, including, CCOG and other type of training grants from the Department of Labor. Let's see, do we have any other questions? Are we running short on time? Catherine, or how are we doing on time?
Let's take one more question.
Okay, one more question. Let's see. I know, John, you did mention something about training capacity in these fields and how it's very limited at this time and not making, it doesn't meet the needs. Is there something that we can do around that as well? Because there are so many regulations with programs and things of that nature. Thank you, Lauren, for putting the CCOG information in there.
It's a great question. Unfortunately, I don't have information on it at this time. It's not something that we've included in that. I don't know, Jason, if you have any insight.
No, sorry.
That's something we've been working with, in our group, and we will continue to address. The capacity for nurses and MLT is an issue that John is stating. And so these are food for thought for us to continue as we work with the collaboratives and the centers of workforce innovation and work with these issues as well. So thank you so much, both Kyle and Jason, for your insight, for your presentations. And as I said, we will be getting back to you for the next update in the summer.
Great.
Thanks so much.
Thank you, Kyle. Great job.
Thanks, Jason.
Thank you both, Jason and Kyle. For those of you all who will be frequent flyers to our collaborative meetings, you will see Jason and Kyle later this week. But thank you, Sandra, for queuing up their participation in June when the new data is out. Now, when I harass them with the email asking them to participate, I'll say, you've been warned.
Sandra said.
That's right. So Sandra, now you're going to introduce our next segment.
Yes, thank you, Catherine. Our next segment is a partnership presentation, and this is something that we will be having at each one of our collaborative meetings, talking about partnerships that are promising, and we really want to highlight what's happening already as we build on these partnerships. So I'm really excited about our partnership presentation. This morning, I'm delighted to have with us partners from Camden County College, from the Workforce Training and Continuing Education Department. We have Kana Hanna, who is the Associate Dean, and Nicole Rance, Success Coach, and they'll be presenting today about their Cooper University Health System Critical Care Tech Partnership. So I'm really happy to have you both here. And just one last thing before we get started. Again, if you have questions, please place them in the chat, and we will ask Kana and Nicole the questions, and they will respond after the presentation as time permits. So the floor is yours, Kana. Thank you, and Nicole.
Okay, so good morning, everyone. I wanted to begin by saying thank you for asking us to present this morning about our partnership with Cooper University Healthcare. We're very excited to be here. So we thought an appropriate place to start would be the purpose of the partnership. So Cooper's Paid Critical Care Tech Internship Program was created in partnership with Cooper University Healthcare, Impact Charity Services Incorporated, and Camden County College, with the sole objective of upskilling Cooper employees into high demand careers within the Cooper organization. The way this program was designed, Cooper handles all of the recruitment and marketing. They have an employee portal where they post the availability of the program, to all interested staff members who meet the established criteria. The criteria that they've outlined for consideration includes employees must apply to the program within the indicated time frame. It's generally about a 1-week time frame. They must be in their current role for a minimum of 1 year. They must have no active discipline. They must have a high school diploma or GED. They must provide 2 letters of recommendation at the time of applying, and one of them must be from their current Cooper manager. And they must be able to successfully fulfill their current work schedule and complete the required 187 didactic hours, as well as the additional clinical hours for the internship program. Upon receipt of all of the applications, Cooper's Human Resources team, as well as their applicable supervisors, work together to determine the final list of participants. Cooper then assembles that list and sends it over to Camden County College for registration. And on average, we've run about 3 cohorts now, and we average about 10 students per cohort. So once accepted into the program, Cooper is actually paying all of the participants $15 per training hour for the full duration of the program. I also wanted to make mention quick that the participants are not generally entering into the program working in patient care. They are coming from other departments throughout the hospital system, such as transport, food service, and housekeeping, just to name a few examples. So I'm going to pass it over to Nicole for the next slide, please.
Thank you. For the critical care tech program, the delivery method is in person. The students will meet 2 times per week. One day is held at Cooper, and then the other day is held at our Camden City campus. The program is 187 hours and typically lasts about 16 weeks. It does utilize an apprenticeship type model in regards to we handle the textbook training, so the RTI, and then all of their on-the-job learning is completed by Cooper. Even though it is an apprenticeship type model, they do not use mentors in this program. The components, the core components of the course are patient care and family communication, professionalism in the workplace, infection control, how to be valuable in the workplace. And then there's also EKG and phlebotomy. Students are prepared for these NHA certifications in the class, but then Cooper takes over and makes sure that the students have the opportunity to obtain the required EKGs and the sticks that are necessary for the certification. And then they help assist the students with the paperwork that they need to take their exam. The EKGs and the sticks take place once the program is complete. And then in addition, students are also eligible to take patient care technician certification through NHA and get their CPR certification within the training program. Since we have started this program, we have completed 3 full cohorts. The first one had 7 students in it, and all of those became placed. The second cohort had 9 students. 7 of them have been placed. One of them went out on medical leave, and then the other, they ended up going into the CMA portion at Cooper. And then we just finished up our last class that had 13 students, and we have another one scheduled for May. So we're moving right along. Next slide. And Kena, if you want to wrap it up.
Sure. Thank you. So our final slide, we thought it may be helpful to close the presentation by sharing some of the ways that the New Jersey Pathways Initiative can support the enhancement and expansion of partnership programs, such as the Cooper example that we've shared. So first, the collaborative can assist by helping to address staffing shortages by increasing the number of feeder program offerings throughout the state. The conversation that we had last week within our particular patient care center was a prime example of how we can collectively identify areas of need throughout the state and really work together to help employers meet that need. The collaborative can assist in expanding student funding opportunities to increase enrollments into the feeder programs. Increasing the number of program offerings is necessary, but if students aren't able to participate, it still doesn't help to meet that need. So if the collaborative can spark conversation with various organizations or even some governmental entities to help identify or create funding opportunities for students, it will assist in ensuring equitable access to training programs for all students. The collaborative can also assist in addressing the required mentor ratios needed for participation in an apprenticeship. This is likely going to be necessary at a state or even a federal level. Our local healthcare providers have shared the challenges they face in meeting these requirements. They're already understaffed, so asking multiple staff members to mentor 1 to 2 apprentices is not manageable for them. In our conversations, our local employers have shared that they would be interested in participating in an apprenticeship if a single mentor could oversee a larger number of apprentices. The collaborative can assist by promoting the upskilling of employees to increase retention and morale. This relates back to my previous point, as this could be addressed by the implementation of apprenticeship programs. However, it will be a difficult avenue for many of our local employers without addressing the mentor ratio issue. We currently see employers, like Nicole had said, they are following an apprenticeship style model already, yet they're circumventing the official apprenticeship due to the various obstacles that we've noted. I know I don't have to tell this group that we've seen the value of apprenticeships for both employees and employers. Employees feel valued when given opportunities for upward mobility, wage increases, and industry recognized certifications. And employers, of course, build a work environment that promotes growth, which leads to increases in morale and retention. The collaborative can enhance the connection of employers to training programs to help in the development and implementation of training in a way that really suits the employer needs. Having the employers participate in our discussions ensures that we are delivering relevant curriculum to our students to support their success. And lastly, the collaborative can assist in the establishment of pathways for students to associate and bachelor degree programs. It's important to give students the seamless opportunities to continue their education. The work of the centers to bridge the existing gaps will greatly benefit the students, the employers, and of course the local economies as a whole by creating the foundation for ongoing career advancement. So this is the conclusion of our presentation this morning, but I wanted to say thank you again for allowing us the opportunity to speak about our premier partnership. And if there are any questions for either myself or Nicole, please feel free to put them in the chat. We are happy to answer.
Thank you so much, Kana and Nicole. And I think really your partnership with Cooper is the main part of what we're doing this for, right? That we want to get industry involved, right? It's they're leading this charge, right? We want to make sure that the programs that we're developing are following what industry is looking for, and our employers are critical to this initiative. So we have a few questions for you. The first one is, what is the acceptance rate for the program? Or what has it been?
I actually do not have that information. I would have to get that from Cooper. They maintain all of the records for the number of students that have applied to the program and the number that are ultimately accepted.
Okay, great. And does Cooper pay Camden County College for the students who attend for the classroom learning? That's a question.
That is actually, I had noted Impact Charities, and I apologize that I did not get into more detail regarding their involvement in the program, but Impact Charities is a local organization who funds that program. They have an initiative they're calling Project Lift to lift students from entry-level positions into more sustainable wages.
And that's a fabulous example of building this ecosystem, right? With a community-based organization and employer involved, as well as the educational institution, and bringing everyone in the community together. So I think that's amazing. Another question is employment retention tracked? And if so, for how long? I know you've just had 3 cohorts, but have you, began tracking?
So Cooper has tracked everybody that has completed thus far, and everything that's been reported back to us as of now. They are still working as critical care techs at Cooper Hospital, with the exception that Nicole mentioned of the one who went on medical leave and the other who decided to go into the medical assisting occupation instead.
Okay, great. And you know what? Can you talk a little bit more about how you built this relationship with Cooper? How has it developed? Do you have any advice on how to, for other employers and educators in the room, how did you build such a great program, and how did it come about?
So it actually originated through Impact Charities. So they had put a student through a training program who then ended up employed at Cooper Hospital. They then continued to follow up with that student, and they saw that the student still was not making a livable wage, even though she was working, it was still per diem. So she was working all of these hours, but still wasn't quite able to make ends meet, and she was on the brink of being evicted from her apartment. So because she was employed at Cooper Hospital and we had such a good relationship already with Impact Charities, they came to us saying, we would really like to implement this at Cooper Hospital. So we kind of band together and presented it to Cooper, and they were fully on board. They were obviously very supportive of upskilling their staff. And as Nicole said, we already have, we've had additional conversations with them about future cohorts. There's no end in sight, and they've already come to the table to say that they'd like to see this replicated for their medical assistants, because they do see a great need in their ambulatory offices for medical assistants.
That's wonderful. I'm so happy to hear that it's continuing and growing, right?
Yes.
Do you have any particular advice, for us in working with employers and how to make such a successful partnership as you have?
I think just maintaining the lines of communication, understanding what their needs are, because especially in the past 2 years, they seem to be changing rapidly. So making sure that there's constant communication with your contacts. I would make contacts throughout the organization, again, as we have, because the individuals that work with the PCTs do not work with the CMAs. So we've really tried to maintain that open lines of communication with multiple contacts within the organization, and just really understand how we can help them to best meet their need. As I had mentioned, it's a perfect model for an apprenticeship, but unfortunately, just given some of the challenges, that has been an area that they've not really been able to pursue. So if we can even help with kind of knocking down some of those barriers, it will only enhance those partnerships.
Absolutely. I know that in several other instances, there has been that issue with the mentor, right? The one-on-one mentor. And maybe that's something we can address moving forward. Did you have to make any changes between the cohorts based on your learnings, or have you pretty much been on a steady course since the first cohort?
We really didn't in terms of the curriculum. It was more so based on the selection process at first. So the numbers that Nicole had shared were the number of completers in the program, but I believe in total we've had about 5 students between the 3 cohorts that we've run so far that have dropped off for various reasons. So we've streamlined that a little bit, tightened it up, just to make sure that we're really accepting folks that we know want to be in this program, we know want to continue their growth within Cooper's system. But that's really the only adjustments that we've made along the way to date.
That's fabulous. The questions just keep rolling in, so I hope you're ready for more questions. Everyone's interested in learning more. We have a great question from a workforce development board. Have you braided any local workforce development dollars or services into this program?
We have not as of yet, but with the growth of the program, I anticipate that that's something that we're going to have to do very soon. We are working with our local workforce development board on incumbent worker training, and this is certainly an area that we are targeting, especially if they decide to go with the CMA down the road. They said it's probably at least about a year out before they venture down that path, but it is a more expensive program. So I do foresee that we are going to have to get some supplemental funding.
We like to hear that you're working with your local workforce development boards as well. That's why this ecosystem is so important. Again, just having all the partners at the table, so we're not working in silos, right? And everyone knows. And I think that's where these ideas come from, right? And keep building upon the programs that we already have and expanding them. We have another question about if you happen to have the estimate of the cost per student and that Cooper pays $15 an hour and the charity pays the rest.
So it's about $3,400 per student. Impact Charities pays that. This past cohort, because it did exceed 10 students, and that was kind of Impact Charities' limit, we were able to get some additional funding through our college's foundation office. So all of the fees for the students' tuition, it includes their textbooks, it includes their NHA PCT certification, their CPR training, that is all included in that amount of money, and it is fully funded. So Cooper pays the $15 per hour to the students directly. It just is included in their paycheck as if it were work hours. And in some cases, the students are making more for their training hours than they are on the job. So it really is a great opportunity all around.
Terrific. I know John asked how many were trained in this program. I know you mentioned it, but can you just mention again the number per each cohort?
It was 29 students total so far within the 3 cohorts. The first was 7, the second was 9, and this most recent one was 13.
Terrific. And do you have an estimate for the next, or you haven't, started the cohort as, recruitment yet?
We do not yet, but our contacts at Cooper said that they have a wait list of people that have been going to them. They're ready to go. So I don't know what that number looks like quite yet, but hopefully before too long.
Terrific. Any other questions? The chat has been flowing, so I might have missed something along the way. I just want to be sure that we didn't miss anything. I know someone asked for Impact Charities website, if someone could provide that, so we can add that in the chat.
I can
Have
post
you,
that in the chat.
I know you said you started tracking retention. So how has that been as far as, employment retention within the program at Cooper?
So from everything that we've received back from Cooper, all of the information, and like I said, we converse with them very frequently. Everybody is still retained. They are still working there. I don't know about the one student who went out on medical leave, but I've not heard of anybody leaving upon completion of the program.
That's amazing. Those are numbers that we always want to hear, right? That's amazing. And it's just a testament to the program, right? And that it works. So we're really so happy to have you here with us today. And thank you. And I know that your representative from Cooper wasn't able to because she was doing a training right now. Oh, one more question. Hold on. There are training dollars available from USDOL apprenticeship grant, which are being used by community colleges. And so, I mean, maybe that's something we think about within the center. How do we turn this into a registered apprenticeship where you're using those training dollars as well?
Yes, we did bring that to Cooper's attention. They just were not able to because of the mentor ratio. It was not something that was manageable for them at the time. So.
Okay, well, thank you so much. I mean, this has been wonderful, and we're so happy to, have had you talk about this wonderful partnership. And if we have any other questions that come in, I'll be sure to reach out to you on those as well. But thank you so much, Kana and Nicole. This was wonderful.
Oh, thank you. And I'll post Impact Charities website in the chat box.
Thank you. Thank you.
Thank you.
So this was a great example of an innovative pathways partnership. We know there are more. At the end of this meeting, we're not done yet. At the end of this meeting, we're going to drop a link to a survey, and we really want you all to answer the survey and tell us about other innovative pathways partnerships that you're engaged in, because we want to invite you all to present to this group in future months. Next up, and our last segment is none other than Aaron Fichtner, president of the New Jersey Council of County Colleges, former commissioner of the Department of Labor and Workforce Development. Aaron really was instrumental in the state adopting the 65 by 25 credential goal that so many in higher ed in particular talk about today. He is a national thought leader with regards to pathways. And he's going to talk today about the importance of this initiative, but also how it will benefit our entire state, right? Make our workforce the most innovative and well-educated, which can propel our employers to greatness and prosperity. So, Aaron, it's on you.
Thank you, Catherine. I always appreciate your introductions, humorous and somewhat true introductions. So thank you. I'll be brief because I know everyone's incredibly busy, but I wanted to start by thanking our speakers today, Kyle and Jason. Jason and his team at the Labor Department do incredibly important work, and they're really important partners in this work with under the direction of Leslie Hirsch as the Assistant Commissioner. And Kyle is an incredible partner, as you can tell from his presentation at Focus NJ. And I just want to thank Nicole and Hannah for their work at Camden and their willingness to share their model. I think that, reflecting on what we've all heard today, I think there's some important themes that run through today's presentations that are important for what we're trying to accomplish here. And I want to touch on a number of those, as we continue on this journey together to get to a more equitable state that has more economic opportunity for more New Jerseyans, that builds that skilled and competitive workforce. I think that the top theme, three themes I want to touch on. One is, underscoring this entire initiative is the commitment to be more driven by the needs of employers and the changing economy. And we want to continue to make sure that our students and our residents are on a path to good paying jobs and careers. We need to continue to better understand the changing needs of the economy, but also to ask employers to be partners in this effort. And so we are so excited that NJBIA is leaned in and is an incredible partner. We are excited about the partnerships that many of you have developed, and we are all developing with people like Cooper, with RWJ Barnabas. You heard about the partnership we have with them. We need employers to come to the table, to roll up their sleeves, to help us work to solve these challenges together. And we are committed, I think, as a whole team, to continue to find ways to bring employers to the table and encourage their involvement. So I think the whole theme of how do we really rethink how we partner with employers in a much more aggressive way. The second, I think, is closely related, which is a commitment that I think you saw from Kyle and Jason's appearance today, that we are committed to making sure that we have better information, better intelligence about the changing needs of the economy. I think, as Catherine said, we have made a commitment as a state to increasing the number of people in New Jersey that have post-secondary credentials and degrees that are valued by the economy. And so central to that question is what are the industry credentials and degrees that we need to be focusing on? And so we are excited as part of this initiative to be partnering with the Department of Labor and Workforce Development, to be bringing in some external resources to help us do the research to better understand the pathways that exist in New Jersey and should exist, built around what are the credentials that are valued by industry. And I would encourage all of you, and perhaps starting today in the chat, as we work with the Labor Department, and we work with Kyle and his team, as we work with external experts to better understand the changing economy, what are the questions that you all have that you think we should be asking? Obviously, we want to better understand what are the credentials that are in demand. We want to understand wages and job requirements. We understand competencies. But we would love to hear from all of you about the kinds of information that would be most helpful to you as you're making the decisions that will ensure that we have an aligned education system with the needs of employers. And then at really the core of this entire initiative is continuing all of us to think differently about how we build those stackable pathways. And I think we all agree that we want to build an education system that has no dead ends for students, that has on-ramps and off-ramps, that helps students and individuals come in and out of the education system, always moving up the career ladder. That is, I think, a core concept to this whole entire initiative. And we believe that when we take that pathways approach, that there are a number of many important connections that can be strengthened. And I want to highlight just a smattering of those kinds of connections that we believe we need to keep developing. And I would say that, having been an observer and participant in the education and workforce space in New Jersey for quite some time, I do believe that we're in an exciting moment where we are building momentum towards this common vision. And the vision that we have developed through this Pathways initiative has really been influenced and created by input from many of you on this call and hundreds of others who are working every day to help shape where we need to go. So let me just highlight a number of the areas of stackability and partnerships that we think are critical to this initiative and to the state's future. The first, the relationship between high schools and post-secondary institutions. As many of you know, our community colleges have very strong dual enrollment partnerships with high schools, allowing high school students to earn college credit, which has a number of benefits. It helps inspire high school students to attend college, community college or four-year college or some other post-secondary education. It reduces the time for individuals to earn their degrees when they get into post-secondary education because they have credentials already under their belt. And if we do it right, it can be part of a stackable pathway that allows students in high school to obtain education and credentials that will either allow them to go to work or to allow them to continue on in a seamless path to higher education. So the high school community college, four-year college relationship is critically important. Within community colleges, we are doing incredible work across our 18, building stronger bridges between our non-credit programs and our credit programs. Many of you know community colleges have incredible non-credit offerings that are aligned with the needs of employers. And so we are working and are committed to working with all of you to build connections so that a student who starts in a non-credit program has a path to continue their education to pursue an associate's degree and then further education, so that there are fewer barriers between our non-credit programs and our credit programs within community colleges. The third area is the community college, four-year college partnership. All of our community colleges have strong transfer relationships with four-year colleges and universities, and this initiative will allow us all to redouble our efforts to better align those pathways so that students in community colleges have a seamless pathway to a four-year college degree. Again, we're building on an incredible set of traditions and laws and regulations in New Jersey that require and encourage those kinds of relationships, and a lot of hard work that's gone on at our four-year college partners and community college partners. But we believe this is an opportunity around our 4 industries and our 10 centers of workforce innovation to better align the four-year college curriculum and the community college curriculum. We heard in the Cooper example about the important relationship between community colleges and community-based organizations. This is really a critical, important piece to all of us from our equity priority. And we know that many community-based organizations in New Jersey play an absolutely important role in preparing individuals for work and for training. We need to do a better job, and I think are beginning to build those strong connections between community-based organizations and community colleges so that individuals can start their training at a community-based organization and continue in a seamless way to further education and training at a community college. We know that proprietary schools offer a lot of important training in New Jersey, and we want to again make sure that there are strong pathways between someone who may start at a proprietary school in a field and be able to have the confidence that they can continue their education at a community college or a four-year college to continue their education. Again, this notion that we have to ensure that there are no dead ends in our educational and training system. The workforce development system is also critically important to this, and I'll highlight one important connection, which is that while we have a highly educated workforce in New Jersey, we have way too many adults in New Jersey who do not have the basic skills or the high school diploma that will allow them to get a job or get further education and training. And so we are excited about the opportunity to work with the State Council on Adult Literacy and Employability Services, SCALES, part of the SETC, to really rethink how we deliver adult education in a way that is connected to pathways and providing literacy services to individuals that are clearly tailored to their occupational interests so that they can accelerate their path to a credential and a good paying job. That is one example of, I think, the many and myriad of relationships that we can strengthen between the workforce development system and community colleges. We also believe strongly that while we have so many adults in New Jersey, with some post-secondary experience and much work experience, but no post-secondary credential or degree. And we believe that prior learning assessments, when done right and thoughtfully, can help create a stronger path for those adults to accelerate their journey to a post-secondary credential and degree. And so we are committed as community colleges to rethinking how we take industry valued credentials and award credit for those credentials so that those students and individuals can accelerate their path to an associate's degree. We know that there are many individuals in New Jersey, thousands and thousands of New Jerseyans who have some industry valued credential or have significant work experience, but have not gone to college and not pursued a post-secondary degree. And we believe that prior learning assessments is a critically important piece to the puzzle. And then finally, the relationship between employers and the work that they are doing to upgrade the skills of their employees is also a critically important part. Circling back to my first point is, how do we rethink the absolutely important role that employers play in this system? I think the partnership you heard about before between community colleges and RWJ Barnabas Health is a model for the kinds of work that we can do to partner between community colleges and employers to help upgrade the skills of existing employees, to help them get credentials and degrees, to help them continue to be productive members of the workforce and to get promotional opportunities and to continue to move up the ladder in ways that benefits us all. So we are excited that all of you have joined us for this first inaugural kickoff of the Collaboratives meeting for health services. We ask that you all continue to work with us to shape this Pathways initiative, to provide your input. I think in the end, I would say that this initiative will only work if we can find ways to share information and work together and to break down the barriers that have, I think, all too long held us back from having an efficient approach to how we prepare people for education, training, and for careers. So I would encourage all of you to be active participants in this initiative, to stay in touch closely with Sandra and Stephanie Samuels, our team working on the health services industry. You will learn more in the months ahead about the incredible work that will happen at our centers of workforce innovation. But we need to hear from employers about their changing needs. We need to hear from the education, training, and workforce system about the innovative partnerships that they are developing so that we can bring them to scale and build on those incredible initiatives. We need to think about new ideas for how do we break down the barriers between all of us? How do we provide financial models to help sustain this work? We are in, as we said before, and as Chrissy said in her opening remarks, in this really unique moment in our state's history where, coming out of this pandemic, we have an opportunity to think a little bit differently than we have traditionally and to commit to creating new pathways and new partnerships to create a more equitable future for the state and make sure that we have the most skilled workforce that propels economic growth. So thank you all for being active partners in this work. Thank you all for joining us in this journey and helping us all break down those barriers, to work together, to learn, to listen, and to act collaboratively in a way that will make a more equitable and a stronger state for all of us. So thank you all for being here today. We look forward to your input and involvement and look forward to monthly meetings of this group, some of which will be in person, to allow us to network with each other. That's an important part of this effort. So we look forward to a point in time when we are all comfortable being back together. I'm sure we'll continue some of these meetings virtually to ensure that people don't have to always drive 2 hours to go to a meeting, since it's certainly more convenient for us all to jump on Zoom. But with that, I'll turn it over to Catherine for some closing remarks, and hope everyone has a great day.
Thank you, Erin, so much. I just want to thank you all, echo what Erin said. If you see this QR code, you can hold your phone to it and get to our website and sign up so that you will not miss any updates or meeting invitations in the future. We send all of our meeting invitations via constant contact using the email address njpathways@njccc.org. I only mention that because even I had to drag out the first meeting invitation from my junk mail. So be on the lookout for that. Also want to, there we go. Certainly you can connect with us over social media. I was supposed to put up a slide earlier with our hashtag for today's meeting, which is just hashtag NJ Pathways. Feel free to post about this meeting and tag us. Also, I want to announce the March meetings for our collaboratives, and they are here. Certainly feel free, while health services or healthcare may be your expertise, feel free to attend any of our collaborative meetings. We have the rest of the February meetings beginning tomorrow, Thursday, and Friday. And thank you all for joining us, and we certainly hope to see you next month. Take care. Enjoy your day.